Good afternoon. Welcome to our channel. I am Dr. JP Singh. So the topic for today's lecture is traumatic asphyxia. Apart from that, we'll discuss some other small topics also. So now we'll move to first slide. Before starting, as is the ritual in our channel, we'll discuss some news. And the news for today is, this. There was a laborer who died when he was working in a pit and some soil was dumped on the body. He died. The news came in the newspaper on 8th of this month. So there was the individual working in a pit and he was there. मिट्टी में दब गया. One is this news, and this news is from last year. The individual was working at the station and trying to connect the bogie with the engine when, due to some malfunction, he got stuck in between the engine and the bogie and he died because of traumatic asphyxia. Right? So, what is traumatic asphyxia? It's a form of asphyxia where the respiratory arrest occurs due to mechanical fixation of chest. Mechanical fixation of chest by an unyielding force. By saying unyielding force, we mean to say that the force externally applied of such a level that it is difficult to move out of it or remove it by the individual or by the patient himself. So, as a result of this heavy force falling on the chest, there is restriction of the normal chest movement. The restriction of normal chest movement, and the chest movement is prevented, hence leading to asphyxia. And almost all such cases of traumatic asphyxia, they are accidental in nature. That means there is no case reported till now which has been diagnosed as a case of traumatic asphyxia, which was suicide or homicide. What are the causes for traumatic asphyxia? Generally, these are stampede, trapping in the mine, earthquake, landslides, traffic accidents, or physical assault. In this stampede or riots, generally it is at such places where the exit or the movement of individuals at such places, it is through a narrow channel and over a very short duration. So number of individuals are more and the exit is through a short duration of these individuals. Hence, these individuals, they are crushed generally under the weight of the other individuals who are behind them. And then trapping in mine or earthquake or landslides. Again, we can see here in all such cases, heavy force in form of part of lands or soil or the earth this thing when they are working in mine, due to the falling of the material they are working with over them, and hence they are pressed from their backside under the mine. And in industrial accidents, again in traffic accidents, it's because of the individual is getting stuck in the parts, either in the parts or in between two vehicles, and during physical assault of the patient by a group of individuals. So in all such cases, these are the scenario where traumatic asphyxia can take place. So what is the post-mortem appearance in such cases of traumatic asphyxia? There is intense congestion of internal organs, along with petechiae and confluent hemorrhages. Petechial and confluent hemorrhages with cyanosis. This cyanosis is generally found to be deep purple or purplish red in color. And it is in case of traumatic asphyxia. It is found over head, neck, and upper chest. That means these are the areas which are above the thoracic level, which are above the chest. Hence, we will find cyanocyst, which is deep purplish or purplish red in color, along with areas of pallor which are already under some pressure or compression by the shirt collar or folds or creases of the garments. Here we will find pallor, whereas above the chest we will find cyanosis. Rib fracture, generally what people feel or other people will feel, if someone is getting traumatic asphyxia, he may have fracture of ribs. But the fracture of ribs, it's a inconsistent finding. Inconsistent finding. So it may or may not be present in cases of traumatic asphyxia. Moving ahead, the heart. On dissection, the heart, as we know, the right side of heart is thin walled because it has to receive blood from the body. It is thin walled. It is damaged early. It is the part which is damaged early in case of traumatic asphyxia as compared to the left side. As compared to the left side, which is damaged late. Right side of heart is damaged early and left side is getting damaged late. As a result, compression on the chest, there is retrograde displacement of blood from the heart, moving back to superior vena cava to subclavian vein and to the veins of neck and head. From the heart, it goes to superior vena cava, from there to subclavian vein, and then to head and neck. Since the venous system in the towards the head or the neck, it is valveless. Valveless movement of the blood takes place from the heart back to head and neck. It leads to rupture of venules and capillaries. There is rupture of venules and capillaries, and there is continuous pushing of blood to that area, which leads to petechial hemorrhages in the skin, eyelids, conjunctiva. These are the superficial part which we can see on examination of the body. We'll see the petechial hemorrhages, which are pinpoint hemorrhages on the skin, eyelids, conjunctiva, and there is bleeding, external bleeding from nose and ears. These are the orifices where the external bleeding will take place, and there are petechial hemorrhages on skin, eyelids, conjunctiva, right? But the veins in the upper limbs, walls are present. In the upper limb, walls are present, hence there is prevention of backflow of blood in the limbs. Therefore, we will not find these hemorrhages on these petechial hemorrhages. They are absent on limbs, upper limbs, but they are present on the level above the chest. The conjunctiva and sclera, they are grossly congested. Already discussed why they are congested and hemorrhagic. And the lungs on further dissection, they are dark, heavy, and subpleural petechial hemorrhages are present, as they are consistent finding in all cases of severe asphyxia. All cases of severe asphyxia, they are consistent finding, right? And the internal organs, as already discussed, they are congested. Moving ahead further, we'll discuss another topic which is very important, called burking. Why it is called burking? Because it's a method which was adopted by William Burke and William Hare in 1927 and 28, where they combined homicidal smothering. They combined homicidal smothering with traumatic asphyxia. Homicidal smothering, when combined with traumatic asphyxia, as developed by William Burke and William Hare in 1927-28, somewhere around this, what they did, after killing the individual, they sold the bodies to doctors Robert, who was working in a medical college for anatomy classes. Because generally these bodies, they were very clear without any injuries, hence they can be used as a specimen in anatomy classes. These individuals, they killed around 16 people. This William Burke and William Hare, they killed around 16 people and supplied the bodies to Dr. Robert. And generally these victims were alone, or they stayed away from their family, and they were invited by William Burke and Hare to their home, intoxicated with alcohol, then thrown to the ground. And after throwing them to the ground, this William Burke, he said or kneel on the chest of the individual, right? And close the nose and mouth with hands. So this is a process of smothering, manual smothering. And the William Hare, he used to pull the individual with the feet, thus killing the individual as a result of smothering with traumatic asphyxia. Now I'll discuss another topic, important topic, postural or positional asphyxia. In continuation with traumatic asphyxia, we should be able to distinguish postural or positional asphyxia. These cases are always accidental. As said, for traumatic asphyxia, generally or most of the times they are accidental. Postural or positional asphyxia, they are always accidental, and they are because of the reason that certain body position, the body is found in such a position that breathing is impaired. Breathing is impaired, which often because of neck twisting. It is because of neck twisting along with kinking or compression, bending or some pressure on the trachea, which along with the positioning of tongue or pushing of the tongue onto the posterior hypopharynx, along with pushing the tongue on posterior hypopharynx. So there is restriction of the movement of air in the upper respiratory tract. The body in postural asphyxia, the body is inverted. Most of the time it is inverted. Hence, the weight of the abdominal organs, it puts pressure on the diaphragm, the first part which separate the chest or the respiratory tract or the thoracic cavity from the abdominal cavity. The abdominal organs, on they put pressure on the lungs and the diaphragm, compressing the thoracic organs due to the inadvertent position of the body, the compression on the thoracic organs with leading to the decreased respiratory movements. Though the system is working, but there is compression on the thoracic organs leading to decreased respiratory movements with cardiorespiratory failure, finally leading to death of the person. Finally leading to the death of the person because of the position of the individual. What are the causes for postural asphyxia or positional asphyxia? It is found to be in forceful control over the aggressive or violent person by law enforcement agencies, by law enforcement agencies, or a group of individuals who are trying to control some aggressive or violent person, so that this individual is held by these individuals. The person who is aggressive, it is held by them in such a position there is severe restriction of movement of the chest, or when the individual fall down accidentally in a well or wedge between the walls, so that again there is severe restriction of movement of chest wall, right? Another is very common finding or very commonly found in intoxicated persons. Very commonly found in intoxicated person who under the influence of the intoxicant, they fall from the bed with head and chest hanging down. As discussed in previous slide, head and chest hanging down, and there is pressure from the abdominal organs, consistent and continuous pressure from the abdominal organs, and there is no movement of the chest because of this consistent pressure. Or the last is the accidental collapse in a narrow space. Accidental collapse in a narrow space means at times many trekkers who are moving alone on trekking, they may fall in a crevasse and or a narrow space with head flexion over the chest. Again, there is very less movement or there is no space for movement of chest or the respiratory area or the respiratory muscles. Hence, it is a perfect case of positional asphyxia. So, these cases of positional asphyxia These cases of positional asphyxia, it is a diagnosis of exclusion. When all other modes of death due to trauma or otherwise they have been excluded, then we can make out, looking at the position of the body in which the body was found and the photos given to us before autopsy, the diagnosis of death due to positional asphyxia is by exclusion, ruling out all other cases. So the body position must be such that it obstructs the normal gas exchange over a longer duration, and there is inability to move or change in the position of the body, maybe due to intoxication or very less or small falling of the body in very limited or small area, very small area, so that the individual cannot change his position, and all other causes of natural or violent death, they have been ruled out. So the diagnosis of positional asphyxia is by exclusion, right? Next slide is we'll discuss this case. We are discussing this case here because in our first lecture of the series on our channel, we discussed the case about Harish Rana for regarding euthanasia. The individual is that time the individual was in a state of persistent vegetative state for around some 13 years. Here we can see some 13 years as a result of trauma due to fall from height. He was in a state of persistent vegetative state, and the case was going on in Supreme Court for passive euthanasia. Till that time, there were no guidelines. There were no guidelines from the law agencies on this topic, on this matter. Hence, the individual is suffering from being alive. So, on last 2 days back, the Supreme Court allowed the withdrawal of support, life support, to Harish Rana, who was in a permanent vegetative state. So, acting on the plea and acting on the request by his parents and medical board reports, the court said his chances of recovery are negligible. The court accepted that the report said the chances of recovery, they are very less, and the court permitted, very important, the court permitted passive euthanasia, and on side by side the court also asked the central government to consider framing laws on the issue. It is one of its kind, or we should say first of its kind case in India where court has allowed passive euthanasia, hence opening a way for many important things. The painful life of the individual who is in vegetative state, or saving resources and efforts. Saving resources and effort which can be used for the cases where life can be saved. And we all medicos should welcome the step taken by the Supreme Court on this case. With this positive note, I'm here concluding my lecture today. If you have any doubts, please write in the comment box. Please like, share and subscribe the channel, and we'll meet in next lecture. Thank you.